Behavior and psychological challenges. This is probably the number one challenge, I would say. And it's just one of those things that, cognitive decline, uh, this is something that occurs with individuals with dementia or Alzheimer's. And so with that, behavioral issues can be agitation, aggression, wandering, restlessness. There's different things that can occur that are kind of regular standard behaviors for Alzheimer's. And then there can also be psychological challenges that are a little bit more advanced than your normal individual with dementia. And so I kind of wanted to talk about those two things. And a lot of these things, again, we want to provide the quality of life for each individual. A lot of these things can be helped with medication. And I know I've talked about this before, that I didn't believe medication in the beginning when I first got into this. But then when I saw an individual come in who was struggling, who had agitation, who was aggressive, who was angry, that she got on some medication and she was lovely. She was kind and friendly and she was able to sleep better and she was in a better mood. Like it was like this completely different person after being on medication. I completely changed my mind on medications. And so we don't overdose individuals to where they're sleeping all day because that's not quality of life. And we don't underdose individuals to where they still are agitated and, have fear and are wandering around, right? We have that perfect Goldilocks mixture, I would say, of medications that we've talked to with the families. And the doctor has also been on board this whole conversation. And it really does help them with their quality of life. And so when it comes to behavior and psychological challenges, a lot of these challenges can be helped with the appropriate medication for the individual. Again, every body is different, right? And so there's not this perfect pill that you give somebody and they are super happy and, great to be around. That's not the case. Everybody has different reactions to certain things. And so being aware that this medication that worked for this person may not work for this person. And so I think it's just being on board with the challenge, right? It's the challenge of, okay, well, how can we create the best quality of life for this person? And so this is probably the number one thing that our managers are really great at, is being on top of each individual and knowing if there's a change in their behavior. Okay, well, maybe they've had a little bit more cognitive decline in the past month. And so this is why they have this issue. Maybe we can talk to the family and the doctor on maybe taking this medication off and maybe adding this medication. Again, talking to the doctor, because we are not doctors. Okay. We just see them every day and we know that there's a change in their behavior. And so being on board with the doctors, having the conversation with the doctors and the families, it's like that triangle, right? It's that triangle of communication. It's the three of you constantly in conversation about what's the best change you can make for the loved one. And so with these behaviors, common behaviors of anxiety, depression, fear, resistance to care. Resistance to care is probably the number one thing that we see. Showers are like the worst thing in the world for our grandparents. It's so funny because I always go in there and tell grandparents, I take 2 showers a day. I take one in the morning and I take one at night. Like they're the best. They're just like, no, I don't like the shower. It's just it's a fearful event for them. And so just trying to create an environment where they're comfortable in that is very challenging. And so another, as far as common behaviors, repeating words, repeating stories, there's agitation, there's aggression, restlessness, right? Common psychological challenges are hallucinations, unjustified suspicion, and holding false beliefs. And these can be kind of scary for staff, especially if they work the night shift, because there's a lot of hallucinations of seeing certain things or people within the house. We had an individual that could swear that there was a little boy at the end of the hall, or there was another individual who was saying that someone was trying to kill her that lives in the house. It's just these unjustified suspicions, right? And so knowing that they do encounter these things and that certain medications can help with these things is important to let your staff know as well. We also had another individual who saw cats. She hated cats and she saw cats everywhere. So we had to close her blinds because she said there were cats outside of her window trying to scratch in and get to her. And so the hallucinations, you're going to encounter those things. And so I did want to point out insider tip. This was something I did not know for starting in assisted living. And if you are in the medical field and you have medical background knowledge, you probably are like, yes, Laura, I know this. But I say this for people who don't know. If you see a change of behavior in somebody within your house, say they're happy-go-lucky, they're always in a good mood, and all of a sudden they are angry. Maybe they're starting to forget things more than normal. There's just a change in behavior that is so abnormal for them. I would call your PA, call the hospice, whatever they're on, and ask if you can get a urine sample, because more than likely it's probably because they have a UTI. And so urinary tract infections, this is common that if they do have a UTI, that they do have a change in behavior. We don't have these very often because we are really good at doing the 2-hour bed checks and making sure they're going to the bathroom every 2 hours. But there is certain circumstances where they do get a UTI. And so getting them on antibiotics as quickly as possible is you'll see a change in behavior. It's so interesting that a UTI can make them so angry. And it's because a lot of times they don't know that it's happening in their body, but they know that something is painful, that there's something that is causing pain in their body, but they can't really vocalize it to you. And so that's why they get angry. That's why they have kind of a change in behavior. And so insider tip, if that happens to you, make sure that you are on board with your PA and hospice nurse and get them checked so that you can start them on antibiotics and hopefully cut that UTI pretty quickly.